doctor will look at the image or at the mammogram, and they will see a lesion. And the question then is that something that is likely to be a cancer, or is it nothing? And then there is one of two options. Either the doctor can take a biopsy or opt to follow the patient up to see if there's any progression in the lesion. Now, AI has advanced learning. It learns from all the pickup or all the abnormalities, the subtle changes that occur in the mammogram that increase the risk of a lesion being a cancerous lesion. And this then shows up or pulls the eye of the doctor that is reading the mammogram to that area, and further enhances how we interpret an image. So we would then a doctor would then look even more carefully at that specific area. So it saves time in that regard. Though instead of looking through the entire mammogram for a long period of time, it kind of pulls your eye to a specific area that's already an area of concern, so that you can pick up that area a bit easier. And also the accuracy when two people read it is actually much better. It decreases the amount of false positives compared to false negatives. So the pickup rate is actually even better.
Indeed. Now, looking at some of the benefits of genetic testing in breast cancer treatment plans, how does that impact decision making?
Massively. So it affects the way you even, from everything from screening to surgical management and follow up of patients with breast cancer. So, for example, if a patient has a genetic mutation which increases their risk of breast cancer, then one may opt to start screening them a lot earlier than the average population, which is recommended to start screening at the age of 40. Over and above that, we would offer them surgery in terms of, for risk reduction purposes, depending on the abnormality or the genetic mutation. And then over and above that, if they are diagnosed with a malignant lesion, the treatment can be adjusted or modified to account for the type of mutation. So, if, for example, people who have the BRCA mutation, number one or two, they respond really well to the new kid on the market, which is the PARP inhibitors. So that would be something that we can use for those patients. And then again, follow up of all patients with or without cancer. Obviously, those ones with the genetic mutation, you're going to be do more comprehensive screening or surveillance, also in terms of ovaries, colon, depending on the mutation that the patient has.
Now, what are some of the limitations in terms of the how have biological agents changed the landscape of breast cancer treatment, and what are the limitations of these advancements?
So, biological agents like Herceptin have definitely changed the landscape of treatment of breast cancer treatment. Patients who who have access to the biological agents, like for example Herceptin, they actually often do really well on the treatment. It makes that particular cancer that is susceptible to the Herceptin treatment. It makes it respond much better, shrink much faster, higher rates of complete pathological responses, or where the tumor disappears completely as a result of giving treatment beforehand. The disadvantages is cost and access. So the cost of these drugs, they knew well, not so much Herceptin, but the other ones are new on the market. And with them comes an incredible cost. And not all the medical aids cover them. I'm not even talking about the government sector, where in certain areas, Herceptin, which is now on the market for more than 10 years, is still not even available. So it is an upward battle in terms of access to care, but we know that the cancers that are susceptible to this targeted treatment respond really, really well. So
Mm.
it is a huge gain and advance in the management of breast cancer.
Mm. Now, milestones have already been reached, but what does the future hold when it comes to breast cancer research? And what are the most promising areas of focus?
So AI, where we started off, AI enhanced imaging is definitely an area where there's a lot of work being done. Imaging itself, there's now things like contrast enhanced imaging and a whole lot of different advancements in terms of how we detect cancer or and breast cancer in particular, to make it easier, more effective, more efficient, decrease the false positive rates where we're worried that there is a cancer, giving the patient unnecessary stress,
Mm.
and increasing the true positive rate where there is a cancer and you detect it. So we want to improve on that. So that's definitely an area that is a lot of research and money is going into. Other areas is definitely the medications that we are using
Mm.
and the targeted therapies. So we're starting to look at certain genetic components, specific receptors, and directing treatments to those specific areas to basically improve outcomes for the patient,
Mm.
target the exact thing that's making this tumor grow and causing this tumor to actually be there in the first place. So
Mm.
that's those are the bold areas where we are expanding in.
Mm. Excellent. Now, what can listeners prioritize when it comes to their breast health? And what resources are available for those affected by breast cancer?
So, in terms of breast health, I think the most important thing that I would like to the message that I want to get out there is that don't be afraid of your boobs. I think if there is a concern, one should definitely have screening done. Over the age of 40, it is recommended every year, or at least every second year. Examine your breast clinically. I mean, feel them, feel for any lumps, bumps, look for any dents.
Mm.
Get comfortable with your breast. Breast cancer is extremely treatable. It's extremely treatable. Um, in Especially if it is diagnosed early, all those words that we associate in fear that are related to cancer and breast cancer in particular, like chemotherapy and all of these drugs and radiation and surgery, all of those things, they are much smaller. They can be managed much easier. It can be just a blip in the curve,
Mm.
rather than a huge insult to the body. But this is about acknowledging that as women and obviously some men are at risk of developing breast cancer, and to be proactive and get your screening done. In terms of resources available for those who are already affected by breast cancer, the greatest advice that I can potentially give is find a team that is dedicated to breast cancer management. We like to talk about this in terms of a multidisciplinary team. That is a team that comprises a breast oncologic surgeon, a plastic surgeon, a medical or radiation oncologist,
Mm.
and all the different parts that go around it. Why? Because they can make the ease the journey, take
Mm.
away a lot of the fears, and optimize your outcomes in terms of breast cancer management. And hopefully, use up to date techniques and methods in terms of your treatment.
Mm. Excellent. Dr. Fatima, thank you so much for joining us and for really painting the picture for us in terms of where is breast cancer in terms of AI enhancement. We really appreciate the information, and if perhaps listeners are listening to you and they're thinking that they'd like to connect with you maybe more, or where can they go? If someone is maybe suspecting something when it comes to their breast health.
We are on Facebook and Instagram, and we have a website. Our practice is called Affelstedt Hussein and Associates. So they're welcome to check out the website, and our numbers are on there, and we are always happy to help in everybody.
Thank you so much. Have yourself a blessed evening. We appreciate your information and your heart to help when it comes to breast cancer. Blessings. Thank you so much.
Thank you very much.